Xanax or Alprazolam is a benzodiazepine that is very strong and works quickly. It can be used in cases such as anxiety disorder or panic attacks. And one of the benefits of it is that because it can have a quick effect to help anxiety, it can be used in conjunction with starting a medication that may be more of a long-term option, such as a Zoloft or Lexapro. Caution though, Xanax is very strong, effective, it works quickly, so people have a tendency to get really hooked onto it or addicted to it. Not just physiologically, but psychologically as well. There can be a dependence to it. So these medications have to be taken pretty carefully. If it's been taken for several months or years, it cannot be stopped abruptly because there's a chance for a benzodiazepine withdrawal seizure in those cases, and a benzodiazepine withdrawal seizure can be life-threatening. This medication also is closely monitored and regulated by the Food and Drug Administration because there can be this addictive potential to it. Also, it can be mixed with other drugs. So if it's lost or stolen, an early prescription may not be easy to get either from the doctor or the pharmacist, and a police report should be filed. Additionally, this medication works on similar receptors in a similar way to alcohol and opioid pain medications, so it really cannot be mixed with alcohol or pain medications. If it does, it can slow down the breathing and people actually can die from the mixture of the two. Although there may be able to take it at small doses, but it should be used really cautiously. There's been also some thoughts that long-term effects of these medications can lead to dementia. It's not conclusive evidence, but there is some support for that. On the other hand, I have had patients who have been on this medication for over 40 years on really high doses, and they don't have signs of dementia, and they're into their 80s. This medication can have a withdrawal effect that leads to mood swings or anger. Because it's so effective, there can be this withdrawal reaction to it. So I'd use it especially cautiously in people with head injuries or cognitive impairment or dementia. It can actually make them more upset or more agitated and have an adverse effect in those cases. Also, it should be used in caution with people who have a history of drug addiction or tend to get addicted to drugs or alcohol. Because of the addictive nature of this medication, probably should not be prescribed to those sorts of people.